right? But if there is slight uh, gaps or slight crowding, it can get corrected with the help of veneers. Even stains also get corrected with the help of veneers. So I would obviously lean towards veneers.
Venus, it's a very interesting word. I often hear that every other day, right? So what it is actually in science terms, please explain us. And also, why do they make our tooth very attractive?
It's a thin layer of shell of a porcelain or a resin which has been applied on the front surface of a tooth.
Okay, front surface means
Only on the front surface. Okay, so it's like a fashionable outfit that is worn on your tooth, which will make you look more natural.
Great.
Okay, it closes all your gaps. It removes all your stains. If you are a heavy coffee, tea, or red wine drinker, this is the best line of treatment. It is customizable. If you want some kind of shade, it can be made. Okay, it is less invasive. Like minimum amount of tooth structure needs to be altered. And it is faster line of treatment. It can be done in couple of visits.
Okay.
And all individuals who are in front of camera are mostly they usually go ahead with this kind of treatment. Why? Because it gives a more natural and pleasing appearance to them.
Okay,
and it's a beautiful a mode of changing your smile. It just changes your personality completely.
Great. So can we refer this to as false nails?
Kind of.
Do you have any story in your mind that you gave a treatment to your patient which changed his life completely? Do you have any story?
Yes, I cannot forget those. I'll just mention two individuals. One is young and one is he's aged.
Great. We would love to hear.
So one lady, like, she was very shy and very conscious, and she had visited many dentists, but somehow she was not happy, or she didn't get the treatment done in XYZ. So she came to our office clinic, and we did her complete analysis, her facial expression and her smile line and everything. Then we delivered the veneers according to her smile. And trust me, she started crying on the chair.
Wow.
Like, I gave her the mirror and she just started crying. That was a moment I still get the goosebumps, looking at her. The changes that she got through the transformation, forget that. Once she went back, everyone was shocked whether, seeing her, whether she's the same individual or no. Her professional life increased. She's still in contact with me, and she keeps texting me, how you've changed my life. Her career has grown to a next level. The positivity that comes from her from within is completely changed. That is one example. See, I'm still having the goosebumps.
Great.
The other one is when I just told you regarding the old age.
Yeah.
He had many missing teeth, unable to eat, and health issues and this and that. So her daughter got him to my clinic. I don't know where they came to know, but touch wood, they came to my clinic and got the treatment done. He was around 89, 90 years.
Okay.
And post that, his health just increased.
Wow.
Because that function that we led or just gave them through the teeth, he was able to eat way too much, and his weight increased, his health increased. They've given such a huge big review on our Google.
Okay.
So it really makes me happy to deliver such kind of smile and function to such kind of patients.
This is my personal observation. I have a lot of friends, and I don't see the usage of braces anymore. I don't know why. Has something changed? I don't know, but people are using this new, you can say, equipment, if I'm not using the right word, but which is also called Invisalign, right? So what's your take on that?
See, obviously, the generation has completely changed. Earlier, there were only metal braces or ceramic braces, and different kind of brackets that were attached to your tooth. but there were a lot of flaws or a lot of difficulties to the patients where they faced, like the wire is pricking, they're unable to eat, there's difficulty in speaking, there are ulcers in their mouth.
Right.
But in say around 20 years back, in 1997, if I'm not wrong, Invisalign had they had actually founded or launched at that time.
Okay.
But with time, it has come all over the world and spread all over the world, and now it is booming in India as well. Yes, I'm grateful that few of the brands, like which are endorsed with some celebrities, have created a lot of awareness.
Right.
So yes, Invisalign is the option to get our teeth aligned. Why? Because it is easy to maintain your teeth. Okay, you can. There is no restriction in eating any kind of food.
Mhm.
It is invisible. People won't come to know that any kind of treatment is going on.
Okay.
Okay, and it is convenient. It is faster. So always, this generation wants that convenience and faster mode of treatment. So that is why the traditional method is slightly being taken aside, and then Invisalign is overtaking them. But yes, to be honest, not all cases can be done through aligners. When it comes to complex cases, traditional are the
So is there
options.
any age limit, or you can say age range, that we can have this Invisaligns?
No, to be honest, there is no age limit as
Okay.
such, because tooth movement does happen in all kind of ages. When it comes to the age factor, your tooth movement can happen at any age.
Okay.
Okay. But if you want to get a better facial structure and everything, it is always better to get your alignment done at the growth spot, whether it is girl or a boy. So at the age of say around 11 to 14, if you get the
Okay.
teeth aligned, that is the best time to get that aligned for the long-term stability of your tooth and
Okay.
a good aesthetics.
Okay.
Okay, so age factor is not really a matter.
So this is a very curious question. Okay, has anyone come to you, like client or you can say patient, come to you and said, we want a smile like Hrithik Roshan, or you can say Shah Rukh Khan? Has this happened to you?
I would not say Hrithik or Shah Rukh, but yes, there was a lady who told me that I want a smile like Madhuri.
Wow.
It was a pretty the conversation was very interesting when it came to such kind of statement, like I want a smile of Madhuri Dixit, but I need to know what their a goal is,
Okay.
like every individual has got a different smile, right?
Great.
So when it comes to, for an example, if someone wants a smile like Hrithik,
Right.
he's got a elongated teeth,
Mm-hmm.
he's got bright teeth, he's got good alignment. So what factors are you looking at?
Hmm.
So we can produce that kind of smile to them. Like not necessarily his teeth length or alignment or smile will match that person. So it all depends on the facial structure and tonicity and everything,
Okay.
right? But if there is slight gaps or